Let's take a look at the frontal bone here. The frontal bone is what makes up sort of your forehead in the skull. The frontal bone can be broken up into three main parts we talk about. The squamous part, that's the flat part. Squamous means flat. The orbital part, which makes up the orbit or the eye, and then the nasal part, which will form a suture with the nasal bones, the nose. So nasal in pink, orbital in tan or yellow here, and then squamous part in blue. If we zoom in on sort of that orbital region a little bit, we can see this hole here known as the supraorbital foramen. Supra meaning above, orbit referring to the eye, foramen meaning hole. This little ridge that forms above the orbit, this is known as the supraorbital crest, and sometimes this supraorbital foramen will slide down and merge with that supraorbital crest and make a notch instead of a hole. So in some individuals, there's a supraorbital notch instead of the supraorbital foramen. This portion over here is known as the zygomatic process. This will come down and it will form a suture with the zygomatic bone, which makes up your cheekbone. This little line here, that's known as the temporal line, and this portion of the frontal bone is also known as the temporal part. We look inside of the orbit here. This little depression here is known as the trochlear fovea. And then over here you have the lacrimal fossa. And this lacrimal fossa will sort of house the lacrimal gland. This little ridge on the nasal part, this is known as the nasal crest there. In some individuals, if we look, this nasal part of the frontal bone may or may not have this suture here. It fuses and goes away in adults, but this is known as the mesotopic suture there. If we spin this around and we look at sort of the inside of the frontal bone, we will see this little crest here, which is known as the frontal crest. And then we can see these little depressions here, over here, which are known as the meningeal fossa. And so these are caused by blood vessels that serve the meninges. And that is your frontal bone. Later.